Every great journey begins with a single step. And at JCK Hospital College of Health Sciences, that step is met with warmth, guidance, and possibility. Here, learning goes beyond the books. It is where future healthcare heroes are nurtured by passionate instructors who believe in their potential. From theory to practical, our healthcare assistant students gain real-world skills in a real healthcare setting, preparing to serve, support, and make a difference from day one. Because at JCK Hospital College of Health Sciences, we don't just teach healthcare. We empower excellence. Admissions are now open for our May and June intakes. Step into your future today. Find us at Blessed House, 5th floor, opposite Garden City Mall. JCK Hospital College of Health Sciences, empowering excellent healthcare.
At JCK Hospital, we understand that a child's smile is priceless. That's why our dental services are tailored with care and compassion to ensure your little ones have the best experience possible. From gentle checkups to specialized treatments, our pediatric dental experts create a safe and friendly environment, making every visit fun and stress-free. Because we believe healthy habits start young. And for the grown-ups, we've got you covered too, with top-notch dental care for the whole family. Visit JCK Hospital today, located in Roysambu, opposite Park University on Lumumba Drive, and experience dental care that's gentle, professional, and family-friendly. JCK Hospital, you first.
Greetings and welcome back to yet another transformative episode of the healthyyou program. This is your favorite health program on Faith Today television. My name is Enock, Kitondekijja, your host. And I'm so honored to walk this journey of health, healing, and transformation with you. A special thanks goes to JCK Hospital, our esteemed partners. Now, they make this program possible. Should you need any healthy services, emergency services, they're right here at your service. You can find them in Roysambu along Lumumba Drive, just next to Happy Life Children's Home. They're also in Mariaini and Juja. You don't want to miss this. JCK Hospital College of Health Sciences was also taking in students. Make sure you get these details using that number on your screen. Now, did you know that 1 in 4 pregnancies end in miscarriage globally? That is over 23 million lives lost every year, according to WHO. Think about this. For every number, there is a mother who never got to hold her baby, a father who never got a chance to say hello, a family that is carrying invisible grief. Now, could it be that recurrent miscarriages are not just a medical challenge, but a spiritual, emotional battle that so many couples are fighting silently? Now, today, we unpack a very interesting conversation, deep but faith-inspired. We are talking about miscarriages, recurrent miscarriages being unmasked, when every loss feels like the last. until hope wins. And to help us unpack this important discussion is no ordinary set of people. We have a lady today, a mother, a survivor of multiple pregnancy losses with us on Faith Day Television, along with a doctor, an expert, a consultant obstetrician, and gynecologist to help us put all this into perspective. You don't want to miss this discussion. Those of you who are tuning in for the first time, we want to welcome you to Faith Day Television. I know there are those of you who watch us on social media. Remember to like this conversation. If it is your first time, please subscribe. Follow us so that you don't miss out on any important discussion that we have to offer. We have that number on your screen. In case you have any question, you have any concern, feel free to reach us using that number. Welcome. Again, like I told you, today is special, like no other. Allow me begin with introducing our first guest. This one is now becoming famous, very common on our screens, the expert. Of course, Dr. Charles, welcome once again. Feel free to introduce yourself once again.
Thank you. Viewers. Thank you. Hello, viewers. My name is Dr. Tung'ani Muchiri. I'm a consultant obstetrician and gynecologist. That is, I deal with matters reproductive health. I'm glad to be here to discuss this important topic and grab a cup of tea because it's going to be interesting. Welcome.
Like he said, grab a cup of tea. You don't want to miss any bit of this discussion. He's not alone. We have a lady, a friend of mine, Phyllis here. I want her to introduce herself and also say hello to our viewers. Welcome, Phyllis.
Hello, everyone. Praise Jesus. My name is Phyllis Irungu, a mother of 3, a child of God, and an entrepreneur. We deal in construction materials, my husband and I.
She has said a mother of 3, but to get to that 3, there is a journey, and you don't want to miss that journey. I am going to get her back soon, and welcome again, Phyllis, to the show. For those of you who are tuning in, remember this program is brought to you by none other but Jessica Hospital. Thank you, Jessica Hospital. Dr. Ali,
yes.
Let's begin with you. I know so many of our viewers, before they get into the story, they want to understand what really is recurrent miscarriages. And then when does it become a medical issue?
Okay. Yeah. Thank you very much. There is the medical definition of a miscarriage, which can vary depending on where you come from. And I'll unpack that a bit more. But generally, when you look at what WHO defines as a miscarriage is any pregnancy lost before getting to 20 weeks, that is halfway through, or or a baby that is not more than 500 grams. Because in good centers, it is considered that a baby above that weight or gestation is able to survive. But when you go to various centers, you will find that most of those are too young to survive. So people have tried to vary the definition of a miscarriage. There is a slight difference between a miscarriage and a pregnancy loss, because really any pregnancy that does not give you a live birth, whether it was at close to term or it was at 30 weeks, is a pregnancy loss. So it's good to get that distinction. And you've asked when it becomes a medical issue. Really, any pregnancy lost should be a medical issue, and people should try and figure out what went on and how to help the person.
And I like it when you bring it now into perspective, that any pregnancy lost should not just go unnoticed. The medical people need to know, the doctors need to help you assess and come to the actual finding of what where is it coming from. I think that is very important. That, speaking of that medical issue, what are some of the causes of these miscarriages? You called it also pregnancy losses. And what are some of maybe the risk factors as well? You can marry them as we progress.
Okay. First is to say that the miscarriages are quite common, actually more common than is brought to the limelight. You did mention that even up to 1 in 4 in centers that report really well, people will talk about 15 to 25% of pregnancies ending up in being lost. And why that number varies is because some pregnancies are not even noticed. There's an entity we call a chemical pregnancy, where a woman may be pregnant, but the miscarriage happens so early that she does not even notice. You may just think it was your menses and move on. So the number may actually be higher than we know. And some of the causes are known, some are not known. I think the majority is when we don't know what causes it. But we have come to find that there are some causes that are more common in these pregnancies. One is what we call chromosomal abnormalities. When I'm talking about chromosomal abnormalities, I want you to imagine your life starting as one cell, or let's say 2 cells that merge and form 1 cell. This is a very tiny thing. You cannot even see it with your naked eye. And this thing is supposed to intricately replicate into 2 daughter cells that carry exact portions of the chromosomes. These are very tiny things you cannot see. And that process is supposed to repeat itself millions of times for you to form even the tiniest of embryos. Now you can imagine if there was even a tiny error that probably there was supposed to be 23 chromosomes moving this side and 23 moving this side, and you just end up with 1 moving to the opposite side. Everything that follows that cell is not normal. So because if it happens, the earlier it happens, the worse the outcome, because you can imagine when it's starting as 1 or 2 cells, that is what will form everything. It will form a baby, it will form a placenta, it will form all the membranes. So if it happens later when the baby is already formed, those might be tiny deformities that can, that are compatible with life. But if it happens very early, when, the things have not differentiated, then that pregnancy is not likely to progress. And this we've found to be the most common cause of miscarriages, especially when they occur early in the first trimester. Other than that, there are other causes that can happen. Remember, this pregnancy, let's say it has formed well, it has to be carried by a healthy mother. It has to be carried in a normal container, that is the uterus. And it has to be contained in that container. So anything that can affect those 3 factors can also affect the pregnancy. For example, if the mother has medical conditions, let's say, that can affect the pregnancy. I'm thinking about high blood sugar, like diabetes, hypertension, sometimes thyroid diseases, sometimes diseases of the blood system or the immune system. There are some conditions we call the antiphospholipid syndrome. There are some conditions we call thrombophilias. Those are medical conditions that affect the mother, and they can affect the pregnancy, leading to miscarriages. Other than that, we said that this pregnancy has to be carried in a healthy container. So if there is any structural issue with the uterus, where the pregnancy is supposed to be carried, you can also end up with a miscarriage. I'm thinking probably if you have masses growing in there, like a fibroid that is too big, or maybe there is scar tissue inside, all those can lead to a miscarriage. And lastly, I say that this pregnancy, it has to be contained within the uterus. So what contains it? Remember, it's also a weight. So there has to be something that is holding it in, and that is the work of the cervix. So the cervix is like the neck of the womb, or the entrance to the womb, and it's part of the birth canal. So if it's not strong enough to hold the pregnancy, you can also end up with a miscarriage. That in a nutshell is some of the more common causes. Of course, I've not mentioned other things like lifestyle and environmental exposures. For example, if somebody is using recreational drugs or some medication that is toxic to the pregnancy, maybe they are on anti-cancer drugs and so on, that can also lead to miscarriage. And your lifestyle also, things like extreme weight, like obesity and some dietary habits can also predispose you to miscarriages. That said, it is good to note that in majority of the cases, it is not something under the control of the mother, and it's good not to stigmatize. Right. I think I don't want to sound too technical.
Yeah.
So maybe you can.
And I like the way you put it. In the African setting, that is so common. Stigma, blaming, and I know we are going to get to you, Phyllis. This is something that you need to also help us. We see so many miscarriages in Africa. Why do you think it is so important to address it today?
Because of the impact that miscarriages have. One, on the couple, and more so, I believe, on the mother, because she's the one who's carrying the burden and she has to suffer the medical consequences on top of the psychological consequences. Secondly, because they are very common, we said up to 15% in conservative centers and up to 25% in others. So they are really common. And number three, their impact on the healthcare system, in that this is an extra cost to the healthcare system. So it's good to take the seriousness that comes with these miscarriages. And more so, the psychological aspect is ignored. We tend to ignore that a lot, and we know that it affects, and I would say generally, the family. Because if the mom is not well, the whole family is not well.
Wow. When the mom is not well, the entire family is not well. Right now, we are going to be hearing now an experience of a mother, Phyllis here, who has had a number of them. She's going to walk us through, Phyllis, walk us through the journey. Was it a chemical? He talked about a chemical pregnancy. That is something, that miscarriage, something I'm hearing. I'm sure most of our viewers are hearing it for the first time. How was your experience like? When did you get to know that you miscarried?
Mine first one was, it's called a stillbirth. When you give birth and baby dies during birth. That was number one. I've had 5 miscarriages. I've carried 8 pregnancies, 3 survived. So there's the medical one that it's called brightened ovum. At 8 weeks, you realized, yes, you can see there was a pregnancy, but it's no longer there. That's now the chemical part that he's talking about. And now the other one, you carry to 22 weeks, and then you miscarry at 22 weeks. Yeah. Wow.
And I like it that you have now mastered the terms because of what you've gone through, and I like it that we get to hear your experience. And how has it been like for you? Doctor talks about emotionally, it affects emotionally, psychologically. How has it been like for you?
It's been tough. Emotionally, it drains you. It drains you to the point that you feel you're numb. Like you don't think or you want to sit and cry the tears that have already dried because you've cried enough times. And when you're emotionally drained, as he said, it affects the entire family. When mommy is sad, dad is sad, the children also suffer the same. But we thank God for my husband, who has been there to support me emotionally. Yeah, because you need someone who understands when you're down. They know why you are down, and they recognize and acknowledge that you are down, so they don't just push you down further. They try and lift you up. In terms of emotions, miscarriage, I think, is the most draining thing that can ever happen to a human being. Something I would never wish even my worst enemy to go through. Yeah.
Wow, that is quite profound. And I am taking my time because I don't want to miss any part of this story. I know you didn't talk about the breakthrough time. When did you get a breakthrough? Because I realize in your story you talk about having twins, and then you talk about the 139 period whereby you lost one and then the other survived. How did that even happen?
For the twins?
Yes.
Now for the twins, we realized you're pregnant. And at 8 weeks, having previously lost a pregnancy that you don't know you had, at 8 weeks, it's when the doctors can confirm. They confirm now these are viable pregnancy. They call it viability at 8 weeks. So we were waiting for that 8 weeks because we know the story, how it goes. Before 8 weeks, you might go and find there is nothing. But yeah, you are pregnant, but at 8 weeks, there is nothing. Now at 8 weeks, you're waiting, counting, anxious. And at 8 weeks, we go and we confirm you're pregnant and realize it's a twin pregnancy. Dr. Tung'ani, we didn't tell him before. We knew we had twins, but when we went to his office, we didn't tell him we are pregnant with twins. And then after the scan, he's like, you guys, do you know you're pregnant with twins? And we're like, yes. And now he says, now comes the hard time. One pregnancy didn't survive. Now there are two. This now calls for a tougher job. And you told him, now that's why we are here, because you are the expert, as we are just here carrying the pregnancy. And now that's where the medical work starts. We went through well until we did a stitch. There's a magnolia stitch and there's another one, which I knew then, I didn't know. It's called a transabdominal stitch, which is more, he will explain further because of the medical terms.
Okay.
It was a procedure that took 5 hours in theater. And after that, we thought, wow, we've made it. Now we are good to go. Our twins are safe. But 4 weeks later, our bubble was busted. And we had a miscarriage with the stitch. Now here I am asking my doctor now. We went to theater and we were happy. Now what is going to happen next? I have a stitch which is up there. We cannot reach it. It can't be teared by even the baby. Because the other pregnancy with magnolia stitch, I would have a miscarriage even with the stitch. So that one we knew the baby can come even with the stitch. But now this one, you have to go back to theater again to remove the stitch. I remember asking him, now we are going back to the theater. What is the outcome? What is the worst thing that can happen? And he's like, the worst thing that can happen, we might lose the 2 pregnancy or we might lose 1. Okay. After we lose 1, what happens to the other one? You know, now in my mind, I'm thinking, how can I lose 1 and the other one remains in my womb? How? And he's like, it happens. We can carry it. When you lose 1, we carry the other one, but still it can still be lost in between. So here we are working to see what will happen. We go to theater, we remove the stitch. And now here my doctor tells me, you know, Phyllis, I'm giving you 3 days. We stay in the hospital and we see what happens. I'm like, we see what happens. Yes, because even me, I don't know what will happen. We wait and see what happens. Now I realized now is the time to put my armor of faith on. And I realized that I remember telling God, you brought us here. You brought Dr. Tung'ani to our lives with all his medical experience. And now he's telling me he don't know what to experience. We are waiting to see what happens. So I tell God, you see that doctor you brought to me, get in his mind, advise him in your own way on what he's going to do, because me, I don't know. I'm just here waiting, don't know. And then I told God, even if you take the babies, I will still serve you, because you are the one who gives lives.
That is serious faith. I know I'm going to cut you short. Before we get to at that level, Dr. Tung'ani,
Yes.
give us your experience. Why is this story so profound? Like, what is so different with it that we get to see her happy today? I mean, there are challenges like you talked about. There
Yes.
are certain instances whereby you also don't know where this is coming from, and you're just, looking up to God. Why is this so unique story? I mean, you could also say something about it.
Right. I remember when I heard about, she shared her story,
Yeah.
the first time when you're taking history.
Yeah.
And right on, it hit me that we are not dealing with one thing here. Because when, as doctors, we like to deal with one diagnosis. You come, you have malaria, we treat that. But when I listened to her stories, she had a combination of factors that were playing into her not able to get, a baby at the end of her pregnancy, because she's losing one in the first trimester, which we are calling a blighted ovum. That is looking like the chromosomal anomalies I was talking about. She's losing another one, or I think two, in the second trimester. And that was now looking like it's more of the structural issues. Maybe the cervix is not holding. That is why they were putting a stitch. But she has also lost another pregnancy at term in the third trimester. So things are really mixed up. So I knew from the word go that this is a complex issue. Then now she did not make it easy, because now she had twins, which is also a bit of a complicated pregnancy. And she was already pregnant. So the issue of putting a stitch was quite difficult, because, with twins, the uterus is much bigger, and already the cervix had an issue. We could not put the stitch there. So it was not an easy case to manage. And I can say it was one of those that give you sleepless nights. You get to do a lot of reading, a lot of cross-consulting, and I'm lucky I got to cross-consult with a lot of colleagues who offered some good insights. But by and large, I think what got us through is her faith. Because every time I was looking like I was giving up, I would look at her and see the kind of hope and faith they had with Jack, her husband. And I would feel, then who am I to give up on this issue? So for me, it was really a learning experience on not just medically, but on the human side and the spiritual side of how to handle some of these difficult issues.
At what point did you kind of give up? What point did you come to, the end of yourself? Because I know you knew so much, but now this one is a bit complex and complicated. At what point did you get to exploit all your tactics?
I can tell you, every time between 16 to 28 weeks.
Yeah.
Because every time I would see a call from her, I think my blood pressure would go up a bit.
Yeah.
Just wondering if it's worse. But when we put the stitch and the stitch failed and we had to go to theater to remove it, I think that was a really low moment for many of us. It was like a community, because even at the hospital, everybody knew Phyllis and her story. And when they heard that the stitch had failed, that was a really low moment for everyone. And then subsequently, I think 2 days later, when the first twin came out, we were really low. We just knew that this is it.
I like the word you say, this is it.
Yes.
I think for our viewers, we can say this is it for first part of our discussion, because I know I need to get more. I need to hear more of how did you even maintain the second, twin. Yes, you lost the first one, but how did you get to? For our viewers, this is an interesting conversation that you don't want to miss. We've had a very rich background of where these miscarriages come from, the definition. We've gotten to hear a brief story about how she gotten to experience all these kinds of miscarriages, a number of them. And then when she gets to finally get her breakthrough, that is when she again experiences the same. It's an interesting story. We are going to take a break. And when we return, we are going to hear the other part of the story, because for every story, there is bad, but there's also good. Want to hear what really sustained her. I'm liking it because we get to now hear doctors admitting that the faith of the patients also play a very key role in helping them perform their duties. So in our second segment, I think this time we will take the first 3 questions. So if you had sent your question already, I'll pick it first. So do not change your dial. We're coming back in a short while.
Every great journey begins with a single step. And at JCK Hospital College of Health Sciences, that step is met with warmth, guidance, and possibility. Here, learning goes beyond the books. It is where future healthcare heroes are nurtured by passionate instructors who believe in their potential. From theory to practical, our healthcare assistant students gain real-world skills in a real healthcare setting, preparing to serve, support, and make a difference from day one. Because at JCK Hospital College of Health Sciences, we don't just teach healthcare. We empower excellence. Admissions are now open for our May and June intakes. Step into your future today. Find us at Blessed House, 5th floor, opposite Garden City Mall. JCK Hospital College of Health Sciences, empowering excellent healthcare.
Faith Today TV is here to make your brand outstanding. Worry not on where to advertise your business or your product. Call us on 0114 777 000 or email us on info@faithtodaytv.co.ke.
Hello there, my name is Enock. Taking care of your health should be a top priority. Looking at the various engagements that we have today, it is so easy to forget about our health, mental well-being. That is why we introduce to you the healthyyou talk show, a brand new show that is going to address matters concerning your health, nutrition, stress management, mental health, name it. We bring to you a wide range of experts who are going to be touching pertinent issues concerning our health. Tune in every Tuesday at 10 a.m. live on Faith Today TV. All right, welcome back once again to our second segment. We are talking about miscarriages, how you go through them. And we are having a story today. It is a very special show because we're having a very true story, a practical setting where we get to hear Phyllis's story coming through all the number of miscarriages she went through up to a point where she gets now twins and all hopes are so high. She knows, okay, this is it. God has, come through. And then at some point she gets the news that she cannot hold both of the twins. So we're here to dig deeper into that story and get to hear the uniqueness of it and to understand when the breakthrough came, how did that happen, and things like that. And I know you are following us from wherever you are watching us. Make sure you send in your question. I'm going to be looking at the messages and taking the first one. I hope this discussion is a blessing to you. And if you feel encouraged and if you feel empowered, you can as well support this television. It's making sure that these stories come to you. Such experts come here. Jessica Hospital is also one of our partners, making sure this program is possible. If you can as well partner with us, we will welcome that. We'll be really glad to see that you are part of this movement. Daktari, yes. I know we are going to get to her to get to hear how she managed through, but we want to hear your side of story, from your medical point of view. How often or even rare do you get such instances where someone carries twins and then they get to lose one and then they retain one? How common is it in your practice?
Well, it's very obvious that twins are not born at the same time. Even if it's a delay of a few seconds from the birth of the first one to the next one, there is always that delay. But a delay that goes into days and into weeks.
How many days?
It's very rare. For her, I believe it went to 139 because we came from 16 weeks to 36 weeks. And it's not very common. Actually, because we did a lot of reading, we even tried to do a case report on the same. I think the one I found close to that was 132 days. So it's not very common. 20 days, 3 weeks, time like that is a bit more common. But
you read and all you got was 132 days. But yes. Now this is your personal story, yes. 139. Okay.
Yes, so, and it was not 130 easy days.
Yeah.
It was 139 days. She can tell you the hospital visits,
yeah.
the night scares,
yeah.
the hospital stays. It was not an easy journey. I know for her it must have been extremely hard.
Mm.
So there were a lot of moments that came, after the first twin came out. We waited, in the hospital with bated breath, and nothing happened. I waited again. She was on medication, though. Sometimes even as a doctor, you are not sure if it's your medication that is working. Are you treating yourself or are you treating the patient? So I think it's just by faith that, the first week she went home, and even though we had a few scares here and there and many hospital visits, nothing happened to the other twin. You just do a scan and you find him playing, oblivious of everything that is happening around. And we were able to push until 36 weeks. I know her story is very different from mine because she went through it.
And I think that is why we have you here,
yes.
to get to hear your story, to get to hear her story. And of course, Doctor, thank you so much for affirming that. Phyllis, you talk about you waiting for 139 days before you deliver. What really powered your faith? We talk about faith, but hearing this, I'm thinking not so many people get a chance to hear such. What really powered your faith and what kept you going? Did you even successfully deliver this baby?
What kept my faith? It's knowing that the Lord is my shepherd. Psalms 23 always gave me the strength, knowing that the Lord is my shepherd, I shall not want. Him being my shepherd, and my field now was in the hospital bed. I knew he knew I was there and he knew what is going on. So I left everything to him. Like, I'm here, you're my shepherd, I'm your sheep. Take to me wherever you want me to feed. You lay me on green pastures. I want to experience the greener pastures now that I always read. Now I want to feel me laying on it. And then a question I always ask myself that gives me hope. Why not me? You see, rather than asking yourself, why me? Who do you want to be? Who else do you want to experience this? If you're asking God, why not me? And then I started asking myself, why not me? And I told God, if this is for you, I'm ready for it. Show me what you want with myself and with my family through this story. I think that's what kept me going. And the fact that I told God, now you have given me this doctor, work on his head. Me, I don't want to think about what will happen tomorrow. Give him the pressure of thinking on my behalf.
Yeah.
Me, I'll just sit and wait.
Okay.
Yeah.
And God had that prayer. Surprisingly, God hears
Indeed.
prayers in, those unexpected moments. Daktari, I'm happy that you admit that you guys got to the end of yourselves and then you have practiced all that you can. How, at that moment, I know she didn't obviously tell you, I am believing in you, I'm praying for you. What was going into your mind? What kept you going when you have practiced all you knew? Did you even come to a diagnosis? Maybe just to take us back.
In medicine, there are things that are straightforward. That 1 + 1 is 2, and you're able to take history. They're the same routine that we take. You take history, you examine, and you do your test, and you come to a diagnosis. Sometimes you are not able, and it calls for you to go back and read. You can go back, do your research, read a bit more on the condition. Sometimes that does not help, and you have to go and cross-consult with colleagues. You ask, I have somebody, you can anonymize that and say, I have somebody who has this and this and this. What do you think? And you can even co-manage with a colleague, a patient. And eventually all that may not give you an answer. And I think that is now when you lean on faith.
Yeah.
I think for her case, we went the full, that full routine up to a place where we admitted, okay, we don't seem to know what is really good for her, but things seem to be working because we've put a stitch, we've put her on medication. She still lost the first one. When you read in literature, you're seeing that the number of days that this baby can survive is fewer than you'd want because she's at 16 weeks. You are hoping to at least push to 28. That is about 12 weeks. When you go to your literature, you're seeing that most go to a few weeks after. And you know that in Kenya, the babies that survive at least have to get to at least 28 and maybe, 1,000 grams a kg. So here is a situation where we are seeing we don't have much chance.
Mm-hmm.
But your patient is upbeat and very, very hopeful.
Mm-hmm.
And you're also even questioning yourself, why does she have so much hope?
Yeah.
Well, I'm not sure where I'm moving, but the long and short of it is that I had a colleague who was helping me in her management, and we would share across her hope. When somebody doesn't lose hope, it's also very encouraging to the doctor, and I think it's also part of healing. When you have a positive mentality. But beyond there, we cannot rule out, the role of the Almighty.
Wow.
Yeah.
Wow, thank you so much. Again, I can't appreciate you enough for admitting that you can come to the end of yourself as a doctor. And then I'm surprised that you can even rely on the faith of a patient to help you through. Phyllis, this is a very unique story, I must tell you, and I hope that the viewer out there who had lost hope, who had really given up hope, trying, and then, because there is so much, people out there are going through so much, and then they get to give up, but I'm happy that you didn't give up. Tell us about this. Take us through now the journey of giving birth. Did you even get to give birth to this twin? What transpired after?
Well, after we lost the first twin at 16 weeks, and looking at my doctor's eyes, and he's saying, you know what, Phyllis, my syllabus is over. So we don't know what we are doing moving forward. And I told him it is okay. So now we are leaning on him, God working on his head, starting things up for him to give him pressure to think beyond. And on my side, I'm leaning on hope and faith. After 16 weeks, it was never easy. It was never easy. Emotionally, my husband and I, we were not on the right place because you are sitting, we were always like sitting on a time bomb. We don't know when it will explode. We don't know when we will rush to the hospital. We don't know when we need to make that call. So it was always a time like waiting. I never used to call my husband in any other time because every time he would see my call, he would think we need to rush to the hospital. So I never used to call him, and we agreed, don't call me, not unless it's an emergency. I'll keep checking on you. Don't check on me. Let me just check on you. Even Dr. Tung'ani, I never called him, not unless it's a real emergency, because, every time he'll see my call, he knew that this is it. So after 16 weeks, we head in and out of hospital. We had some emergency. He would have to organize for me for an emergency entry to a hospital. But after that, we realized it's just a scare. The scans are done, I'm on medication, and then we go home. Going home, he would always tell, I know he don't remember, he would always tell us, let me see you on Friday. But he was not sure if we will make to that Friday. And I tell him, I'm coming on Friday.
Wow.
So every time I would go to his office, he's like, okay, you are here again. We are still on. Yes, we are still on. And he tried all the medications. We didn't know what we are doing, both of us. I was told, take this medication, I will take it. Very good. Let me take it. We don't know if it will work, but let's just take it. And those were the longest time someone can wait on something. Remember, my cervix was open for 12 weeks. Medically, it does not happen. When a cervix is open, it means whatever is inside is supposed to come out. But now this baby is hanging on there. He's like, you open me, I'm here. Me, my time is not yet. So when you on that state, every run to the washroom, it's a scare because you don't know what you're going to get. Every run to the washroom, it's a scare. So you can imagine my whole day, I need to go to the washroom, and every time I feel like going to the washroom, it's a scare. So we went on in the hospital and then until 36 weeks. When we got to 28 weeks, he used to tell us, let's hope we get to 28 weeks until at least the baby will be 1 kg, 1,000 grams. And now the time he told us, we look at the scan, the baby is 230 grams. We went home and my husband asked me, is Dr. Tung'ani serious? We are at 200 grams and he's saying we are aiming for 1,000 grams. When will that even happen? And we agreed, okay, it's okay, let's wait. So we were counting days like 26, 12, 13. When we got to 28 weeks, that's when we relaxed all. Like now we are at 26 weeks, 28 weeks, and then he asked us, where do you want to deliver? And I look at him, deliver? Deliver what?
Deliver what? Now he's also now coming to become hopeful.
Yes,
right?
because after 28 weeks, in Kenya, our our hospitals can only handle
Yeah.
28 weeks and above.
And above.
Below 28 weeks, we are not yet there. The government need to do something on that.
Okay.
So at 28 weeks now we start thinking of now delivery. And I even start thinking, I need to shop for this baby now at 28 weeks. So I didn't even do that because still I didn't believe we will make to 36 weeks. Yeah, now after 28 weeks, it's now when we started seeing the grams have increased. Now we are good. So what we were supposed to look is which hospital can accommodate us in case of emergency. And now those are the things that he did. Checking which hospital, in case we call him at this time, this is the hospital you will go. He made sure we are okay. If you run to this hospital, they know you are coming. If you go to this hospital, they know you are coming.
Yeah.
And that's how we managed to 36 weeks with hope and fear and all emotions mixed up together.
Wow. How old is the baby now?
The baby now it's 9 months old.
9 months old.
Yes.
Wow, congratulations. Dr. I see you smiling. What is your experience? Are there some lessons you learned as a doctor in there? Share with our viewers.
Yes. One is that first is to put it into perspective that most miscarriages are random. We may not even get to the actual cause, why they happen. Recurrences are not very common. And so people will talk about even less than 10% that you had a miscarriage, you'll have it another time. So it is a few couples now like Phyllis who get recurrent miscarriages. And I'm glad to have been part of her management, because it also made me look at beyond the medicine, in terms of treating someone. Is there a role for spiritualism and faith and belief, and what part does it play? And it's something that has really occupied my mind, and also it made me grow as I don't know if as a doctor or as a person, because I'm a person who's used to offering solutions. Actually, most experts are just offer a solution and move. What happens when you don't have the solution? How do you handle it? So it is something that also made me introspect as a person, that when you don't have all the answers beyond there. So I can say I learned a lot. I'm glad we can talk about the story now with smiles.
Yeah. And I'm happy to have you guys bring up this story to light, because not so many people get the chance to hear such stories, and they have given up already. For my viewer, you don't have to give up. With this story, this combo, you don't want to give up. The doctors are clearly saying that you can practice all you know, the books, you exhaust all the literature, but you know what? There is God up there who can make a difference. All right. I'm loving this discussion. And I don't know, because I see so many questions here. I don't know if we are going to handle all of them, but I hope we will. All right. Okay, where do I begin now? Because I see most of them, you have answered them. There's someone here is saying, is it possible for your body to reject a pregnancy like it's an allergy? Dr. this is yours.
Yes. Remember when I talked about some of the causes, I talked about immunologic conditions. One of the conditions is called the antiphospholipid syndrome.
Yeah.
So basically your immune system is behaving abnormally, and that affects mainly placentation. And to put it in the same terms, it's like your immune system, in quotes, is rejecting the baby. So yes, there are some immunologic conditions that can cause that.
Okay.
Yes.
All right. This is Anne from Roysambu. She says, is it true that if you miscarry once, you are more likely to miscarry again?
I think I've just said that because most miscarriages are sporadic without a pattern, it's not common for recurrent miscarriages. However, if you've had a miscarriage, you have a slightly higher risk compared to somebody who has not had a miscarriage of having a miscarriage in future. Just slightly higher risk.
Yeah. Okay. This is Felicitas. Hi, I'm Felicitas. Can long-term use of birth control pills cause future miscarriages?
Not to my knowledge, because once you stop the birth control pills, the effects are supposed to clear off. So there has not been clear indication that that is so.
Okay. All right. I'm trying to get those that really need urgent answers. This is Stella. Good morning, team. Stella here. Just a quick question. Are recurrent miscarriages more common in women over 35 years?
Yes. Unfortunately, we found that age is a factor.
Age is a factor?
Yes, when it comes to miscarriages. So the risk is higher in that age group. We speculate that it could be because of the hormonal support of the pregnancy, or it could be because of the structural support, and also to some extent the quality, the egg quality, because as you grow older, cells keep changing, and remember, for a woman, she never makes new cells in the ovary. So it's what she had at birth that is ovulated every month. So as you grow older, there are changes to the cells that can affect the chromosomes.
Okay. Wow. I know we cannot answer all these questions today. Even doctors don't have all the answers.
Yes.
Today we get to hear that. Because of time, I know we can have this conversation over and over again. I know there's someone who is watching you, Phyllis, today, and they have gone through a number of them. I don't know if they have even reached your numbers, because yours seem to be so many, but you never know. A lot is happening out there, and people are going through so much. Would you, as you give your parting shot, say a word to a mother out there who has gone through so many miscarriages? She has lost hope. The doctors we've learned also, they also lose hope sometimes. Give them a word of encouragement, and then show them there is hope.
To you, who is there wondering if you are alone, you're not alone in this. Yes, it happens, and it doesn't happen because God is punishing you or anything. It's just, we are in this world we were told, He said He will be with us even when we are on the valleys. It is even when, not even if, because it is even when, because we have to be on those valleys. Everybody has their own valley. And you as a mother, you are there. Miscarriage, it's your valley. Don't lose hope. All you have to do is, when it happens, cry, because you'll have to cry. Have those, wet your pillow with your tears. But at the end of the day, just remember our God Zakha, who remembers. He will one day remember you. You don't have to lose hope, because when you lose hope, it's when the devil comes in and starts preaching to you how impossible it is, and it is not impossible. All you need to do is have hope, keep on trying, keep on consulting. Don't just sit and say, I've tried one doctor. And you see, doctors, everybody has their own different experience depending on how many cases they have seen. So what I would advise you, don't just go and see a normal doctor. Look for a gynecologist who has already have an idea of what can happen, because some cases can be solved through medication. Some cases can be solved through your faith. Don't lose your faith. And for you husbands, always stand by the side of your woman. Don't listen to that auntie who is telling you you need to look for another wife who can bear you children. Stick to that one and keep the hope and keep the faith. At the end of the day, our God will reward you. I've been there, and now there's a story of victory through faith.
Amen. Through faith. And I like it that you do business with your husband.
Yes.
And that is rare also. I mean, he has walked with you throughout all these challenges and you still do business with him. Tell us about your business, and maybe you can share your contact so that people who would want to even get more details get to share. I know you can encourage so many people. Share your number and then that business that you're doing.
My husband and I, we run a construction industry. We have a hardware store at Juja next to Cooperative Bank. Anything plumbing, electrical, anything you need to do with your building, call us. Our number 0708 301717, that's for Jack, and 0720 5558, that's for me.
So if you want anything to do with the encouragement in terms of giving birth and hope, she's the one. Then for business, Jack. They have the number. Thank you so much. And then Dr. we want to get your parting shot.
Yes. I don't know. I can't dilute what she has said.
Yeah.
But there is the role, what I've said, there is hope. And like she has said, it's not punishment if you're going through it. See your medical practitioner. There is the role of medicine. There is the role of faith. And there is the role of hope. So if you're going through something, share with people. Maybe I can share my number.
Yeah.
My phone number is 0780 477 862. Thank you.
And thank you so much, Dr. Every time we get you on board, we really get a very insightful, we get insightful discussions, and we get so much knowledge from you. We really appreciate your time. We don't take it for granted. You're a great resource, not just to JCK Hospital, but also to the entire Kenya and Africa at large. Thank you so much. Thank you so much, Phyllis. I was about to call you Dr. Phyllis. I know you can treat so many people's hearts.
I can.
And that is the journey. Those of you who are just tuning in, that has been the healthyyou program. We have talked about miscarriages. We know that now medicine explains things, but not everything. And there is a place for hope. Faith, never lose your hope. There is hope. Miracles still happen. We've learned that even doctors get to the end of themselves. But you know what? When you still have hope as a patient or as a client, a miracle can happen. My name is Enock Kitondekijja, and you have been watching the healthyyou program. Until we meet next time, stay proactive, stay hopeful, do not lose faith. God bless you.
At JCK Hospital, we understand that a child's smile is priceless. That's why our dental services are tailored with care and compassion to ensure your little ones have the best experience possible. From gentle checkups to specialized treatments, our pediatric dental experts create a safe and friendly environment, making every visit fun and stress-free. Because we believe healthy habits start young. And for the grown-ups, we've got you covered too, with top-notch dental care for the whole family. Visit JCK Hospital today, located in Roysambu, opposite Park University on Lumumba Drive, and experience dental care that's gentle, professional, and family-friendly. JCK Hospital, you first.